Sean, I remember in my first month of moving to Las Vegas, I got both a sinus infection and an eye infection. And I quick Googled the nearest urgent care in Henderson where I was staying. Still have the number of that urgent care in my phone because you never know. And this brings up an interesting topic is like urgent care versus emergency room. And today we're going to discuss with one of our favorite doctor friends.
We've had this very conversation in the Tempesta household many times when the kids get sick. Dr. Jeff Morosky is here, the Chief Medical Officer with Silver Summit Health Plan, joining us now to clear the air. How are you, sir?
I'm good. How are you?
Doing okay. I think a lot of
Great.
people, some people get a little bit frightened and they immediately go to the emergency room. Others know how much that can cost and go to the urgent
Yes.
care.
It's not an easy question.
Where's the line? When should we say, what,
Yeah.
this is not an urgent care thing?
I think the first thing is you just use your judgment. If you really think it's a life-threatening emergency, you should go to the emergency room. So you just kind of put those words in your head. Is this life-threatening?
Yeah.
Then you can kind of use some other guidance around what's urgent care. But I always remind people to start with, is this something my primary care doctor would do? And should I start there first?
Yeah, absolutely. Doctor, I'm recalling previous conversations. You've spent some time in emergency rooms, haven't you?
I have. Yeah, I worked in an ER
Yes.
as I trained and when I first came out, and worked in urgent care as well. And it's a whole spectrum and in primary care. So kind of seen that whole thing. I mean, and there's typical diseases that kind of fall into different buckets. Clearly trauma. I've been stabbed. I've been shot.
Yeah.
That's an ER visit, right? That stuff's easy. I think I'm having a heart attack. That's an ER visit. That's pretty easy. I think I'm having a stroke.
Ooh,
That's an ER visit. Those are easy ones. Then there's easy ones for urgent care too, right? Really bad cold, sinus infection, minor burn, minor cough,
Yeah.
kind of streppy
there you go.
stuff. Yeah,
Yeah.
like it's really acute. I can't get into my primary care doc, and I need to get seen. That's clearly urgent care. Even things like mild dehydration can be urgent care. And mild injury can be. Ear pain's a good one for kids. That's urgent care. Doesn't need ED necessarily, but like seizure, that's ER.
Hmm.
So it's looking at those things. Asthma is the toughest one. I always tell people, you just use your judgment. How sick do you feel?
Yeah. It's really it's a coin flip. I know that there's a cost thing that comes in mind as well.
There is,
And that's
yeah,
what kind of
people think
determines that
about it.
coin flip.
It does sometimes. You have to go where you go, and the good news is that if you're in the right location, the costs will work out.
Yeah.
So it's really most important that you kind of pick that spot and ask yourself that one simple question: do I think this is a life-threatening emergency? If I do,
Hmm.
then that's your judgment. You go to the ER, right? You can call 911 if you need to get there. You can't. You go to the emergency room. But you have to ask yourself that question first.
I'm curious
That
if you
takes a moment.
think you have COVID, you go to the ER, or if you're
Well,
kind of
I
like
think.
light, you feel like a little sniffle, that's about it. Do you go to the urgent care?
Yeah, I mean, I
You
think
got to
you
get
use the
tested.
same. Well, you use the same. Urgent cares can test, and so you use the same criteria you would have used before.
Okay.
Do I have COVID and I have upper symptoms? I've got congested. I have some diarrhea. I don't feel so good. I think I have COVID. Obviously, call the urgent care and say,
Yeah.
"Hey, I think this is the consideration." And they'll tell you, "Hey, I can test you. You can go here." Or
Mhm.
they can't, then that's ER. But if you're also like, "Hey, I think I have COVID and my fever's 104 and I'm really short of
Oof.
breath and I can't move," well, you've kind of found yourself as this life threatening. Yeah, that sounds like an emergency room.
Yeah.
Boy, it's kind of a scale of how scary are your symptoms, and yet sometimes even when you're experiencing minor symptoms, it can be frightening.
Yep.
I get
Well,
very mentally triggered when I'm in pain, as I know Sean does too.
absolutely.
Sean's a big
Yeah.
The
wimp,
wimp.
by the way.
Yeah.
Yeah.
Um,
And again,
so
pain's a good reason, right? Really bad pain, you need to go to the ER.
Yeah.
Yes. Doctor, I was going to ask you real quick. So, having worked in an urgent care as well, what can you say? I think sometimes the perception is that the doctors, the nurses at urgent care might not be as qualified as those you would find in an emergency room. Is there
Well, they're
any truth
different
to that?
trainings. Yeah, it's different training for the nurses and for the physicians and those that work in ERs versus those that work in urgent cares. Urgent care doctors really take care of kind of the not emergent problems fast because that's urgent.
Yeah.
And they have access to certain things you wouldn't normally have in an office. In emergency rooms, those are ER trained physicians who have to know how to deal with the trauma and the gunshots and the stabbing and the acute heart attacks. So again, that's kind of where you find the right stuff. We all went to the same medical school training, that first set's all the same for all of us. For the doctors, the nurses,
Yep.
same thing. We all have the basics.
Excellent. Really quickly before we go, let's talk about Silver Summit Health Plan and what it is you do.
Well, Silver Summit Health Plan is a managed care organization that offers quality insurance to the people of Nevada. We do it through Medicaid and Medicare and the Health Insurance Exchange. We're committed to our members' health by providing compassionate, high-quality care.
Chief Medical Officer, Dr. Jeff Morawski, one of our favorite guests, by the way. So thank
Love
you for
him.
joining us
Very
today.
kind.
Great to be here.
Delightful.
Great
Yeah.
to talk to you, pal. Hey, if you want to learn more about Silver Summit Health Plan, silversummithealthplan.com, a great place to start. Silver Summit Health Plan, a proud sponsor of the Morning Blend.